So let's talk about telemedicine and Medicare. We've talked about commercial payers and state law, but obviously when it comes to Medicare, federal law applies to the appropriateness of telemedicine, right?
Mm-hmm.
And tell us about, is Medicare paying for telemedicine?
Medicare pays for telemedicine services in a select number of areas. Again, as mentioned earlier, generally in medically underserved areas, things along those lines where there is difficulty accessing the complete panoply of care. But Medicare does require the originating site to be a healthcare location. Does not allow, except in very limited circumstances, patients to be located at home or outside of a healthcare facility when they receive a telehealth encounter. However, that is changing, and Medicare, the trajectory of Medicare right now is that we see it ultimately going to allow telehealth encounters in the patient's home. As I mentioned, it's not in all circumstances that it's not allowed. There are certain specific areas, such as patients that are end-stage renal disease patients, and certain other types of patients that are homebound, where they do compensate providers for telehealth. And the movement generally with Medicare, particularly in areas like chronic care management, where they pay for a non-face-to-face encounter, but it's not telemedicine.
Mm-hmm.
It's a process that was actually started by Medicare and reimbursed by Medicare, where there is a 20-minute telephone conversation with the physician or a provider affiliated with the physician for patients that have 2 or more chronic conditions. And that is kind of a form of telemedicine. It's not directly, but it's a non-face-to-face encounter to assure that the patient is compliant with medication, that the patient doesn't need a change in medication. So the move in Medicare is towards providing telemedicine at home.
So in terms of Medicare and telemedicine, you mentioned that one limitation is the location of the patient. The patient has to be at an originating site that is approved by Medicare. When not necessarily the home, it could be, they have to be outside the metropolitan area, you mentioned, and like in a rural area. What about, can you tell us some limitations on the location of the physician? Are there any limitations on where the physician can be during the telemedicine encounter for Medicare?
Generally not. It is really the physician as the licensee, and they can practice medicine from an office setting or from home or a hotel room or from any one of a number of areas. That is not the constraint. Rather, it's just the originating site of the patient. And that originating site does present a number of problems. There are companies out there, there are stakeholders that have an interest in using telemedicine or providing services ancillary to telemedicine, such as pharmacies, durable medical equipment companies, and other providers of service. Medicare, for example, we have seen physicians and pharmacies and DME providers run afoul of the law, because to get around Medicare's rules on telehealth, they have either charged the patient cash or not charged the patient at all for the telehealth encounter. And then when the doctor wrote a prescription for either DME or pharmaceuticals, when Medicare got the bill and they reconciled the claims data, they look and see that, well, the physician didn't bill Medicare, so that essentially nullifies the payment for the order that was written by the physician. And physicians have also gotten into trouble because that process violates their contract with Medicare, and Medicare in some circumstances has revoked physicians' provider status as a Medicare provider. So it's an area where physicians need to be very, very careful to comply with all the applicable laws and with their contract with Medicare.
Have you seen in the last, let's say, 4 or 5 months, any trends or patterns in Medicare's audit of telemedicine? And if so, what could you describe?
Medicare, as a payer, since the inception of the Affordable Care Act, has been very aggressive in recouping money, recovering money for the Medicare Trust Fund. So the folks at Medicare and their contractors conduct audits very frequently, monitor physician behavior, provider behavior, to ensure that it comports with the rules. And if not, there are a variety of different remedies that Medicare can pursue. And those things range from just recovering the money that was paid for an incorrect claim to placing providers on prepayment review, where they have to provide certain additional information before they get paid, to revocation of privileges and suspension of physicians' ability to write prescriptions for certain products, through to actual False Claims Act and criminal activity. So if a physician bills incorrectly on a consistent basis and is determined to be fraudulent, they can risk criminal prosecution. So it really runs the full spectrum, from simple recovery of overpayments all the way through criminal prosecution and everything in between. And there's been a good deal of enforcement actions in the telehealth space, because many telehealth providers and telehealth companies, some that are somewhat unscrupulous, have used telehealth as a vehicle to overprescribe, overutilize, and within that process end up paying kickbacks or illegal remuneration to physicians and prescribers. So it is an area where if the physician is going to write prescriptions or engage in telehealth with Medicare beneficiaries, they must make sure that they comport all of their behavior to the Medicare rules.
I think one thing that we've seen over the last few, I would say even 4 years ago, with TRICARE, the TRICARE government's healthcare benefit program, we saw similar scenarios where physicians were not billing for an office visit, and so there's no medical health benefit bill, but yet there's a DME, like you mentioned, or a prescription that is filled by a pharmacy, and then the PBM will audit the pharmacy, and TRICARE or Medicaid or Medicare will say, why is there a prescription but there's no office visit being billed? So that's just an example
Very
where
true.
the telemedicine visit has to be appropriate, meet all the criteria of the Medicare, and then it's got to be billed properly. If it's not billed, we've seen PBM say it was not quote unquote medically necessary, and therefore we're not paying for it, we're going to recoup the whole amount. But I think you've also seen some Medicare recent audits of physicians where it's not the pharmacy or the DME company getting audited, but Medicare is looking at the physician and saying, why did you not bill for this, or what, is there something funky going on?
Correct. So Medicare requires physicians to bill Medicare beneficiaries. When a physician has a contract as what's called a participating provider within Medicare, and even non-participating providers are regulated by a number of laws, and most of those laws are in place to protect a vulnerable population, the Medicare beneficiary population, which is typically, older Americans. So there are specific rules governing what you can do when treating a Medicare beneficiary, what you can tell them, what you can, if you want to try and get them to waive their benefits or pay cash for a service and not use their benefit. So there's a number of laws meant to protect patients. It's one of the things that Medicare doesn't want happening, is they don't want physicians to say, oh, I participate in Medicare, and the patient come into the office and say, oh, if you want to see the doctor, you have to pay $200 cash, and we're not going to bill Medicare. that is not permissible. The other thing that sometimes happens in the TRICARE example is that the telemedicine company or third party is compensating the physician for the visit and the physician not billing Medicare. So there's a compounding of the problem. Medicare is not getting billed. They're in violation of, the physician's in violation of the Medicare rules that they're supposed to be complying with, and they're accepting a kickback. So there are many pitfalls if not done correctly.
So one of the pitfalls you mentioned was where the physician is being retained, let's say by either a marketing company or a telemedicine company, and the physician is getting paid instead of getting paid by a payer like Medicare, pursuant to Medicare's rules, or a private payer in the commercial context. You're saying that there's a danger for a physician to be compensated by a telemedicine company or a marketing company.
Mm-hmm. Yes. Medicare, well, not just Medicare law, but federal law is well settled. The case law is very clear that when you provide, when a third party pays, other than Medicare or TRICARE or Medicaid, pays for the services of, pays for the medical services, that is a benefit to the patient. And that is an illegal benefit. It's basically a kickback to the patient to utilize the service. Because part of the Medicare process is the patient is supposed to pay a co-payment amount. All right, and co-payments are meant to avoid overutilization and prevent unnecessary expenditures by the federal government. So by a telemedicine company paying the doctor and the Medicare beneficiary not being charged anything, and Medicare not being charged anything, it's circumventing that system and causing, or potentially causing, individuals to get goods or services that they don't really need, because there is no patient responsibility now attached to it. And that's considered a kickback to the patient. It's an inducement to that patient to go and get those services.
So you mentioned some federal and state law that, you mentioned some federal law just now that sort of covers the idea of who should be paying a physician in the telemedicine encounter. And there are certain limitations, because if a patient is being referred by a marketing company or telemedicine company to the doctor, and the doctor is not charging the patient or not charging the insurance company, but the doctor's writing a prescription for medication or DME, as you mentioned, there are some problems there under federal law. You mentioned the anti-kickback statute. Are there also state laws that apply to that situation?
Yes, many states have laws that mirror the federal laws, both the federal anti-kickback statute and the federal, what's called the federal Stark Law, named after the legislator that enacted it, which is a physician self-referral law. And those kind of laws go hand in hand. And those are at the federal level. Most states have similar statutes. Some states basically just mirror the federal statutes, and compliance or violation of federal laws generally will result in violation of state law. And many states also, because they mirror federal law, things that are permissible under federal law will also be permissible under state law.